now I'm going to turn it over to Dr. Julia Trahi, who's going to give us her discussion about tertiary care and some solutions that we believe may be effective here.
Yes, as Brent said, I'm Dr. Julia Trahi, and I graduated from Memorial University Medical School in 1986, and I'm a specialist physician in the area of general internal medicine. I'm also the program director for the R4 residency program in general internal medicine at Memorial, and I'm a nucleus member of the Specialty Committee of Internal Medicine for the Royal College of Physicians and Surgeons of Canada. And I'm a frontline specialist working on the sharp edge of the healthcare system here in Newfoundland. After graduating as a specialist physician and completing a fellowship, I returned to work in Newfoundland and Labrador in 1993. So as a general internal medicine specialist, I participated in emergency on-call. I consulted for patients with complex multi-system and multi-morbidity disease, and I run outpatient clinics. When I first returned to practice, I covered the hematology service for a period of time. I then worked in the cancer center delivering chemotherapy for 8 years. I also covered the infectious disease and ran the HIV clinics for 7 years. I covered gyne-oncology inpatients for a number of years, and I am presently a full-time salaried medical specialist working primarily out of the Health Sciences Center in St. John's. And that will give you a taste of what a qualified general internal medicine specialist is capable of providing in terms of services. I'm here today to tell you and the people of Newfoundland and Labrador that history is repeating itself. So what is my purpose of speaking with you today? And principally and first and foremost is to try to improve healthcare service delivery to the people of Newfoundland and Labrador, and in a place that I love and I call home. The lack of properly trained general internal medicine specialists in this province has led to conditions that make delivery of these fundamental healthcare services untenable and impossible. This situation has become apparent to the general public in the recent so-called gaps in coverage in Clarenville that have been in the news. To call them gaps in coverage does a disservice to the patient population. In some places, there are no services. In others, there's a cycle of short-term fixes, but no permanent solution to the destabilized general internal medicine workforce. It is the patients who are required to bear the burden, the costs, and the risks of these vacancies. There are large areas of this province that do not ever have general internal medicine coverage, areas such as Labrador, which require 6 general internal medicine specialists but have none, and this is a clarion call for attention. Some say this is a problem of rural medicine, but let me be clear, this entire province is rural medicine. St. John's is also rural medicine. For example, the president of the Royal Society, the Society of Rural Physicians of Canada, practices in St. Catharines in the Niagara region. And according to Statistics Canada, the St. Catharines Niagara region has a population of more than 330,000 people. Issues of delivery of healthcare services in rural Newfoundland and Labrador means all of Newfoundland and Labrador, including St. John's. My patients fly in from Labrador. My patients drive 4 hours from Burin and Marystown. My patients drive in from Clarenville. And there's no need for this. These are all patients who should be seen by specialists in their areas. It is dangerous for them, it is expensive for them, it is time-consuming, and it's unnecessary. I know what it's like to have to drive long distances to see a specialist. When I was a child, I had to drive from Corner Brook to St. John's to see an eye specialist. This appointment was very important. It was once a year. My family arranged vacation time around it. My mother doesn't drive, so my father had to take time off work, and we had to come in and find some place to stay so that I could go see the specialist. Now, this is 40 years ago. So I have a real empathy for these people and the hardships they endure, often having to wait up to a year to see me. If they are elderly, their sons and daughters have to take time off work. They have to drive to St. John's. They have to find a place to stay, and then they have to drive home again. There are simply not enough general internal medicine specialists to deliver their care. and the small number of these highly specialized and badly needed physicians continue to dwindle. General internal medicine is short, on a conservative estimate, about 50% here in the province, and there is no systematic or focused plan in place to try and arrest this devastating and relentless deconstruction of our healthcare system. For instance, and this has been touched on by the other people here on the panel, of the 27 general internal medicine specialists practicing in Newfoundland and Labrador, 23 of them are international medical graduates. And of those 27, 2 of them are over the age of 70. Of those 23 international medical graduates, 13 are working under a provisional license, and there was a time when they had to wait until acquiring full license before they were able to leave to work in other areas of the country that want them, but not anymore. Under the recent agreement on internal trade, signed by all the provinces, any restrictions on licensing have been removed. There's nothing stopping these doctors from leaving here to go to places like Ontario, Alberta, and British Columbia. And are these doctors and their families leaving? Yes, they are. And how do I know this? I know because I'm writing letters of reference for them, and I'm calling their employers on their behalf. These are great doctors, and they have options. They don't have family ties here, and it makes no sense for them to endure the heavy workloads and inadequate compensation, which also fails to attract any colleagues to help share the burden. In October, I went to the annual meeting of the Canadian Society of Internal Medicine. Now, this is the national meeting for general internists across the country. And I went with my recruiter's hat on, because lots of young graduates and trainees go to this meeting once a year. And at this conference, I spoke directly with 10 colleagues that had trained in Newfoundland and Labrador and now work in Ontario. And in fact, myself and Pradeep were involved in training them to be good general internists. And I asked them, what would it take to bring you home? And they answered me directly. Nothing being offered today could convince them to return. These are talented physicians who trained in Newfoundland and Labrador for in the last 7 to 8 years, who are now working in London, Ontario, Chatham, Ottawa, Stratford, Hamilton. Not big communities, not big cities. We are paying for residents to train and then leave. In the last 10 years, the government of Newfoundland and Labrador has recruited only 1 general internal medicine specialist that was trained here, just 1. The rest have pretty much relocated to Ontario, and some have gone to Alberta. Every issue of the Canadian Medical Association Journal has advertisements looking for general internal medicine specialists. They advertise the work-life balance, the number of colleagues. I mean, they all start with, would you like to join a practice of 8 other specialists working in a hospital? That provides, and on it goes. In December of last year, the Royal College of Physicians and Surgeons of Canada, the certifying body for Canadian specialists, hosted a national summit to discuss changes to training that directly impacts general internal medicine. This unique event was in response to societal needs for general internal medicine. All ministries of health across the country were invited to participate. In recognition of its importance, Ontario and other